We know that not every procedure that winds up with a complication is evidence of malpractice. But let me jump back to the judgment call. How can we possibly overcome and defeat this incredible defense where the doctor says, don't blame me, this was a judgment call? Let me share with you a story which I think will illustrate very clearly how we can overcome that defense. My client was 37 years old when he went to the urologist complaining of difficulty urinating. And the doctor does an examination, an internal examination, says you have all this scar tissue built up in the tube that takes urine from the bladder and leads it out through the penis. That tube is known as the urethra. There's a simple, quick procedure we can do here in the office that will open up that tube, that urethra. It's known as a cold knife urethrotomy. And by the way, it is as painful as it sounds. And what the doctor does is he takes a tube, inserts it into the penis, into the urethra, takes a knife, and then cuts away the scar tissue. Oh, and by the way, no anesthesia in the office. I told you, it's as painful as it sounds. But you know what? It worked. The problem was, it only worked for a few days. So my client then goes back to the doctor complaining of the same problem. Doctor, I still can't urinate. And he says, you know what? Let's do it again. And so the patient says, okay. Now he does it again. Inserts the tube into the penis, takes the knife, cuts away the scar tissue, and it works for a few days. One of the things you'll learn very quickly in this scenario is that what the doctor should have realized was this was a short-term fix for something that should have been a long-term cure. So now when the patient comes back and says, this isn't working, the doctor says, no problem. I'm going to bring you into the hospital. We'll put you to sleep. I'm going to put into your urethra something known as a stent, which is a coiled metal mesh device. When we're putting it into the urethra, what's going to happen is it's going to spring load open. And it's designed to keep that tube open to allow the free flow of urine. And the patient says, okay, I need to have this done. Let's do it. And the doctor puts him to sleep. He puts in the first stent as deep as possible, and then the thing opens up. Now, what you need to know is that this is designed to be permanent. It's designed to become embedded in the urethra. And it becomes permanent because the skin tissue, known as epithelial lining of the cells of the urethra, grow over it and literally becomes embedded in there. So while the doctor puts it in, he says, you know what? I'm going to put in two back to back just to make sure. And that's what he does. Now the patient wakes up, goes home, and what do you think happens? Well, he no longer has the problem of difficulty urinating. He has just the opposite effect. He can't stop the flow of urine. So now he's got a continual flow of urine, and he calls the doctor. He says, what do I do? He says, take this medication. It will help you slow down, and it will control the urine flow. And that's what he does. But there's a massive, massive problem. Within a few days, the patient recognizes something horrible. Every time this gentleman has an erection, he has excruciating, agonizing, tortuous pain in his groin and his penis. He calls up the doctor saying, I don't understand, I'm having horrible, horrible pain. I've never had anything like this. Doctor says, take some pain medication, no problem, you'll be fine. And he does what the doctor tells him. The only problem? Doesn't work. Because every time this gentleman winds up having an erection, he has the most horrible pain of his entire life. He goes back to the doctor's office, and the doctor writes in his note, patient is having such excruciating pain, he has contemplated suicide. And by the way, I've been in practice 25 years. I have never in my life seen a doctor write down in his notes that a patient has contemplated suicide as a result of pain from a complication that he has suffered following a procedure. He doesn't write it just once, twice. The patient returns back, doctor, you've got to do something. I'm having horrible, horrible pain every time I have an erection. Doctor says, okay, we're going to take you back to the hospital. I'm going to put you under anesthesia again. And I think by moving those stents, it'll cure the problem. Maybe it's hitting the nerve. What does the patient know? He's not a urologist. He says, fine. So now he has this done. And remember what I told you when I said that these stents, these devices, that coil mesh, were designed to be permanent? The doctor now goes in and takes his instrument and tries to move it. Only problem? It doesn't move. It's embedded in the urethra. It's embedded in that skin tissue. He can't move it. He's pulling and he's tugging and he's twisting. Nothing's moving until he starts to pull, and guess what? The mesh falls apart. Now he's pulling out strand by strand of these metal pieces, which are literally destroying the inside of his entire urethra. You're laughing. It's horrible. It is so horrible. By the time this man is done pulling out every strand of this embedded stent, both of them, it literally looks like his entire urethra has been destroyed. And I'm going to jump forward a little bit to tell you that this man needed 18 months worth of reconstructive surgery to cut open his entire urethra on the underside of his penis, to rebuild his entire urethra, and ultimately when he went to another surgeon, a specialist, urological reconstructive surgeon, who took one look at him, he literally said to him, "Oh my God, it looks like a bomb exploded in here. What happened to you?" So now, let's go back to the question. How do we defeat the judgment call defense? We brought a lawsuit against the urologist claiming that it was a departure from good practice to put in these stents. He said, "Hey, don't blame me. It was a judgment call to do this cold knife urethrotomy in the office." And we said, "You know what? You're absolutely right. We take no issue whatsoever with that at all. That was fine. Although it wasn't great for the long term, still it was acceptable." But here's what the doctor didn't know. These devices that were intended to go into this urethra, they were only intended to go in somebody who was 65 years or older. Why? Because it was proven and documented and test studies confirmed that patients who were under the age of 65 who still had the ability to maintain an erection would continue to get these horrendous, horrific types of pain, excruciating, agonizing pain. This urologist didn't know that. Didn't know that. He felt it was medically acceptable to put in this stent into a patient who was 37 years old. So when we asked him, "Doctor, would you agree that this type of procedure is to be used only in the urethra?" "Yes." "Would you agree, doctor, that this type of procedure is to be used only in patients 65 or older?" He just looked at me and said, "No, I don't believe that to be true. We had study after study showing and confirming that you don't put these things into patients who are under 65, who still have the ability to maintain an erection." So now, here's where the judgment call defense comes in. When a doctor is faced with multiple options, if all of those options that are available to him are medically acceptable, the fact that he chooses one procedure, one treatment option over another is not enough for us to overcome that defense. We're going to lose on that issue. But if, let's say out of 4 different options, the doctor chooses one that is below the standard of care, now we will be able to overcome that defense. Because the law clearly will say, if you find that one of the judgments the doctor exercised deviated from the standard of care, then we have proven and shown that there's liability here. It is critical to be able to overcome that defense in order to show that we have a valid basis for a case. And many times there is no other option. The doctor's using just 1 or 2 different choices based upon his considered medical opinion. So I share with you that horrific story, and I apologize if it was a bit graphic, but it's important to understand how incredible this particular defense is and what we have to go through to have our medical experts to turn around and say, "Hey, the fact that you suffered a complication, we know it can occur. Does not necessarily mean there's wrongdoing. But if you now exercise your judgment to put in these stents when it is a clear violation of the standard of care to do that, you, sir, lose." And that's what we did in that case.